Before anything else, do this. Gently pull down your lower eyelid with one finger so you can see the inner rim, the wet, fleshy part below the eyeball. It should be a vivid, almost bright red or deep pink. If it looks pale, or almost white, that's the first sign on this list, and it matters enough that we're starting with it. Here are 6 things your eyes are showing you right now that almost nobody checks, and what each one means. Your eyes are the only place in your body where blood vessels can be seen directly without any imaging equipment. The retina at the back of the eye is not just an extension of the eye, it's actual brain tissue, the same neurological tissue as your brain, supplied by the same type of vessels and responding to the same systemic changes. High blood pressure, high cholesterol, liver stress, anemia, and early neurological changes all leave marks in and around the eyes that a trained clinician can read. Most seniors get their eyes checked once a year and leave with a glasses prescription. The examination that also includes looking at vessels, nerve tissue, and eyelid changes for systemic signs does happen during a full dilated eye exam. But those findings are rarely explained, and most people have no idea what the exam revealed beyond whether their prescription changed. 6 things you can check yourself right now without any equipment. Sign 1. Pale lower eyelid rim. You already checked this in the opening. The inner rim of the lower eyelid, the part that's normally a vivid red or deep pink, gets its color from the small blood vessels and the red blood cells flowing through them. When red blood cell count drops, or when iron or B12 falls below the level needed to make healthy red blood cells, that rim loses its color. It goes pale pink, then almost white in more significant deficiency. This sign is used in clinical medicine as a quick field assessment for anemia, particularly in settings where blood tests aren't immediately available. Research published in the American Journal of Hematology found that conjunctival pallor, the paleness of the inner lower eyelid, is a reliable visible indicator of anemia that shows up before the face or hands look visibly pale. If your rim is pale, ask your doctor for ferritin, B12, and a complete blood count at your next appointment rather than just a standard hemoglobin check, because ferritin and B12 can fall to a point that produces symptoms while hemoglobin is still technically in range. Sign 2. Yellowish tint to the whites of your eyes. The whites of the eyes, the sclera, should be white, a yellowish tint, and you're looking for a genuine yellow, not just an off-white or slightly cream color in dim light, is called scleral icterus, and it's an early sign of bilirubin building up in the bloodstream because the liver isn't clearing it at its normal rate. This sign is worth knowing about specifically because it appears in the eyes before the skin turns yellow. The sclera is particularly sensitive to bilirubin deposits because of how its tissue is structured, which means the eyes are often the first place that early liver stress becomes visible, sometimes by days or weeks ahead of any skin yellowing. Research in the Journal of Hepatology confirms scleral icterus as a reliable early clinical sign of jaundice with high sensitivity at low bilirubin levels. If the whites of your eyes have a yellow tint that persists across different lighting, it belongs in a doctor's appointment this week, described specifically as yellowing in the whites of the eyes. Sign 3. Yellowish flat patches on the eyelid skin. These look different from sign 2. They're not a color in the whites. They're small, flat, slightly raised yellowish deposits on the skin of the eyelid itself, usually near the inner corner of the eye, occasionally below the lower lid. Most people assume they're age spots or a harmless skin change and never mention them. They're called xanthelasma, and they're deposits of cholesterol beneath the skin. Research published in the European Heart Journal and in the Journal of the American College of Cardiology found that xanthelasma is an independent risk marker for cardiovascular disease, meaning people who have them have a measurably higher rate of heart attack and stroke compared to people who don't, even after controlling for measured cholesterol levels. The presence of the deposits doesn't mean your cholesterol is currently high on a standard panel. It means cholesterol has been deposited in a way that the standard panel doesn't always catch. If you have these and your cholesterol has been checked and was normal, ask whether a full lipid panel including particle size, not just total cholesterol and LDL, has been run. Mention the xanthelasma specifically. Sign 4. Persistently red or bloodshot whites not explained by tiredness or screens. Everyone gets red eyes from a bad night, dry air, or hours on a screen. The sign worth paying attention to is eyes that are consistently and noticeably red, across multiple days and in the morning after adequate sleep, without an obvious explanation like infection, allergy, or significant screen use. High blood pressure causes the small blood vessels in the sclera to dilate. Sustained high pressure over months and years produces persistently visible engorgement of those vessels, what looks like chronic mild bloodshot eyes. This is one presentation of hypertensive retinopathy, the visible effect of elevated blood pressure on the eye's blood vessel network. Most people with this sign have attributed it to tired eyes for long enough that they've stopped noticing it as something different. If your eyes are regularly red in the morning when you first look in the mirror, before any screen use, before any environmental exposure, and your blood pressure hasn't been checked recently, that's the pairing worth acting on. Sign 5. A gray or white arc at the outer edge of your iris. Look at the colored part of your eye, the iris. At the very outer edge, bordering where the iris meets the white, you may see a thin gray or white arc, sometimes a partial arc and sometimes a full ring. This is called arcus senilis, and it's a deposit of lipid material in the outer cornea. Here's the age-specific nuance worth understanding. In people under 60, arcus senilis is a significant cardiovascular risk marker. Its presence is associated with elevated cholesterol and increased heart disease risk. In people over 65, it becomes much more common, and the independent risk association is weaker. If you're in your early 60s and have a prominent arcus, it's worth mentioning to your doctor in the context of your cardiovascular risk picture. If you're older and it's been present for years, it's worth knowing about, but not alarming on its own. What it should do in either case is prompt you to make sure your full lipid panel, including triglycerides and HDL, is current rather than relying on a reading from several years ago. Sign 6. A dark, distorted, or missing patch in the center of your vision. This is the most important sign on the list for long-term vision, and you can check for it right now with a simple test that takes 30 seconds. Find a straight edge, a door frame, a window frame, or a piece of graph paper. Cover one eye and look directly at the center of the straight lines with the other. The lines should appear perfectly straight all the way across. Now switch eyes and do the same thing. If any part of the lines appears wavy, bent, or if there's a gray or dark patch somewhere in the middle of what you're looking at, that's the sign worth taking seriously. This is the Amsler grid test, used by ophthalmologists as an early screening tool for age-related macular degeneration, the leading cause of vision loss in adults over 60. The macula is the small central area of the retina responsible for the sharp vision you use for reading, recognizing faces, and seeing fine detail. When it begins to deteriorate, the central vision goes first. Straight lines look wavy, a dark or blurry spot appears in the center, or parts of what you're looking at simply aren't there. Research in ophthalmology and referenced in the New England Journal of Medicine identifies macular degeneration as affecting approximately 1 in 10 adults over 65, rising to 1 in 3 over 80. It is significantly more treatable when caught early, and the Amsler grid test reliably detects changes before a standard vision chart would show anything wrong. If anything looked distorted or missing during that test just now, book an appointment with an optometrist this week, and specifically request a macular assessment. What to do with what you found? 3 paths depending on what the check revealed. If you found sign 6, any distortion or missing patch with the Amsler test, book an optometrist appointment this week and say specifically that you noticed a distortion on an Amsler self-test. That language prompts a macular assessment rather than a routine vision check. If you found signs 1, 2, or 4, inner eyelid pallor, yellow whites, or persistently red whites. Those belong at a doctor's appointment, described specifically using the same language used in this video. Conjunctival pallor for sign 1. Yellowish tint to the sclera for sign 2. Persistently injected conjunctival vessels, not from external cause for sign 4. Clinical language produces clinical responses. If you found sign 3 or 5, xanthelasma or arcus senilis, ask specifically for a full lipid panel and mention what you found by name. Most GPs are familiar with both and will know exactly what to do once they're on the table. Take a photo of any finding today in good light and save it dated. Write in the comments whether anything matched when you checked and whether you'd ever heard of the Amsler test before today, your age, and where you're watching from alongside. If this video prompts someone to catch sign 6 early, the comment telling that story is the one that matters most.